Good morning.
Morning po, Doc.
Morning, Doc. Good morning, Doc.
Morning po, Doc.
Morning po, Doc.
So we have a very short lecture continuation of the before I already lectured to you the basis of our behavioral and psychological differences, as well as how it affects our developmental aspect of human being. No? So before I already lectured to you the basis of our the major basis of our behavior of man, that is by Freud and by Erikson. So we already had that stages of personality development. So this is just a continuation of our school of thought in psychiatry, no? So the person that who contributed, one of them is Carl Abraham. He is from Germany, no? So you can observe that the year is from 1877 to 1925. So the thoughts of psychiatry or in psychiatry is still very early, no? Or it's just a new aspect of science. No, psychiatry is a new aspect of science. So it's just recent. No? So Carl Abraham is one of Freud disciples of Freud. No, he elaborated the stages of psychosexual development. So, how many stages of your psychosexual development? How many stages?
5.
So we have 5 psychosexual stages of development, that is by Freud. No, so oral, anal, oedipal. What is the next? Oral, anal, oedipal. Then you have your
Phallic, later.
phallic. Oedipal or phallic, it's the same. Then the last is your genital, no, the 5th stage. Well, anyway, according to Freud, this is an oral stage in the sense that the satisfaction of infant or the baby or all of us when we were 0 to 1 year old is the mouth. So when we are hungry, when we are having a discomfort, our mother or a caregiver will just place or food or milk into our mouth, so we stop crying. So that is why Freud called this stage the oral stage. But however, according to Carl Abraham, he divided the oral stage into biting phase and sucking phase. No? So this is just an example. Oral stage into biting phase and sucking phase. Then you have the anal stage. He divided into destructive, expulsive, anal, sadistic phase, and mastering, retentive, or anal erotic. Meaning to say, according to Carl Abraham, oral stage, biting phase, you can observe that when the child starts to suck, with the mother, when he or she starts to take in milk, no, you can observe that the child is sometimes bites the mother's what you call that breast, no, the nipple. So in a way, that phase, the biting phase, is shows that the child starts to manipulate, no? So it keeps on biting. So why manipulate stage at this stage? Because starts biting the nipple of the mother would, of course, she feels the pain. So the child starts now to manipulate through biting the nipple of the mother. Sucking phase, of course, that is the satisfaction of the child when he is hungry, no, when he feels uncomfortable. So that is the sucking phase. So according to Carl Abraham, these are just the elaboration of the oral stage. By Freud, total oral stage. No? So everything is being placed in the mouth, but Carl Abraham, it is divided into two phases. No? By being manipulative, start to manipulate the child by biting the mother's nipple. So the mother feels the pain, and sucking phase, no? For the satisfaction of the child. Then you have the anal stage. Anal stage is divided into destructive, expulsive, anal sadistic phase and mastering retentive. And that is what you call anal erotic. What is destructive, expulsive, anal sadistic phase? So you can observe that in the anal stage, it is the stage wherein the child has already the mastery of his sphincteric tone. So anytime when the parents or when he feels moving, no, of his bowel, he would try to control, or that is retentive, no, and that is what you call anal erotic, no. When he tries to control his moving the bowel, that is retentive. So meaning to say, he tries to have an autonomy, no, mastering retentive, no. He can control, but due to anal sadistic characteristic, he tries to expulse his bowel. That is what you call destructive, expulsive, anal sadistic phase. What I'm trying to drive at here is, I just want to show to you that Carl Abraham is one of the psychiatrists that a follower of Freud, but he tried to elaborate the work of Freud. So you will know how I go into the deeper characteristic of the psychosexual development of the oral stage of Freud. Okay? So he postulated that obsessional neurosis resulted from fixation at the anal sadistic phase and depression from fixation at the oral stage. So you can observe that in every stages at the oral stage, in oral stage, if there is a pathologic characteristic, meaning to say, if the patient is not able to resolve this stage, there is what you call obsessional neurosis. So what is neurosis? How does it differentiate from psychosis? Neurosis is characterized by what? By anxiety, no? Persistent anxiety. Psychosis is out of reality. So when you are out of reality, there is hallucinations, there is delusion. Neurosis is characterized by anxiety, no? Persistent anxiety. So you can observe they're obsessional. What is obsession? How do we differentiate with compulsion? So sometimes you have misconception with words you are using. Like for example, now obsessed, but you do not know what is really the meaning of obsession, no? So when we say obsession, that is repetitive thought, that would disturb the patient unless you have to act that thought. Since it is a repetitive thought, in order that it will calm you down, you will have the compulsion. Compulsion is already an action of what you are thinking. So for example, your obsession is my door, the room of my door is still open. You're already lying down. So you have to go to the door of your room, and you have to try to verify whether the room is locked or not. So when you have obsession, you keep on going back to your door of the room because it is in your thought that your room is not yet closed. So that is obsession. So according to Carl Abraham, there is obsessional neurosis. Diba? I told you, obsession is thought, repetitive thought, that is an anxiety, no? So there is what you call obsessional neurosis. So neurosis is not psychosis, no? When we say a person is neurotic, it is usually an anxiety, no? So it is different from psychosis. No? So this is according to Carl Abraham. So another contributory psychologist or psychiatrist is Alfred Adler. He is from Vienna, Austria. That is in 1870 to 1937. So again, you can see that psychiatry is just a new science, no? Unlike an other characteristic, other medicine, what you call that, branch of medicine that it has been already established long time ago, no? So according to Alfred Adler, no, he is a general physician. He he postulated on aggression, no? So he said that aggression, when you have aggression, that is striving for power, no? He don't believe on libido, that is libido theory, sexual origin of neurosis or infantile wishes. Libido is energy in your thought, no, in thinking, sexual energy in thinking. That is libido. Alfred Adler don't believe that, but Freud believed that there is what you call libido and theory on sexual origin. So we have neurosis according to Freud because of the libido that we have in our mind. No? So the neurotic phase is due to our libido theory of sexual origin. So the root cause of neurosis is sexual, no? But it is not active. It's still in our thought. So Alfred Adler do not believe on that, but he believed that aggression, he postulated that aggression is striving for power. So we get irritable, we get mad. That is because we strive for power. That is according to Alfred Adler. But however, this is just a part. So aggression is not just only striving for power. It is a combination of many factors. But according to Alfred Adler, that is his postulation, no? He postulated on that aggression. We have aggression because we strive for power. Then he said that he postulated what you call individual psychology. I described the tendency to move from a passive feminine role to a masculine active role. So you can observe that there are times when female do an active role or a role, or there are activities of a female that are similar to males, masculine active role. So there are times even if the females used to talk, but there is a feminine role to a masculine active role. So you can observe there are males sometimes go into, when you fight, you go into male characteristic of fighting. So that is what you call individual psychology, masculine protest. So we females have a characteristic of masculine role. Later you will know as we go on with the different school of thought in psychology, in psychiatry, you will know that there are masculine side of a female. So you can also see that there is a postulation or principle of dynamism according to Alfred Adler. He said that every individual is future directed and moves toward a goal. So he believes that all of us, that everyone has a goal in life. So that is what he called principle of dynamism. Then he also had the term inferiority complex. So this is according to Alfred Adler. Inferiority complex refers to a sense of inadequacy and weakness. And this is not only in Tacloban or in Leyte, but this is universal and inborn. So everywhere you can find this, what you call inferiority complex, the sense of inadequacy and weakness. So if we have that in ourselves, maybe if we have an inadequacy or weakness, you have to try to cover up your inferiority by developing your skills, because all of us in our development, according to Erickson, you have to develop your skills during our latency phase. So in order that we will be able to cover up our inferiority complex, we have to do something to ourselves, because it will destroy ourselves if we always have a sense of inadequacy and weakness, because that is inborn or innate in a person. But how we be able to cope up, we have to do something, because all of us passes the stage of latency where we have our skills development and other characteristic of human being that enable us to try to cover up our weaknesses and inadequateness. So that is according to Alfred Adler. So you can see that our inferiority or somebody's inferiority becomes profound when, especially, we have self-defect. So that's why now there is already a law that even if we have some congenital defect, our walking, we have our gaits, in walking, the law said that everybody should be equal when it comes to work. So that is organ inferiority. It develops child's self-esteem is compromised by a self-defect. So the more, if we have an inferiority complex, the more that we become inferior if we have some self-defect. So basic inferiority tied to children's oedipal longings could never be gratified. So meaning to say, inferiority goes back to your, what is oedipal stage? Oral, anal, then you have your phallic, no? 0 to 1, 1 to 3, 3 to 5 years old. It goes back to our oedipal stage. But however, he said that it can never be gratified. So even if we have something to do with skills development, but it is said that a person can never be gratified because we have to go back to our oedipal longing. So, but what is important is we should be aware that we have some inferiority characteristic in us so that we can do something about it. Not we become unfriendly, no? We try to become schizoid characteristic because of our defect in ourselves and our inferiority, which can never be gratified. But we have to try to ourselves to become productive in life because all of us have talents, have skills and abilities. So we have to develop in order to cover up our gratification and our inferiority, which could never be gratified. So be aware, no? When you try to become, by having an inferiority, try to think that you have your talents and abilities, no? So develop that. So here, Alfred Adler also try to postulate on the importance of children's birth order. So many things in life, as I mentioned before, that these things affect our behavior. Another important aspect is children's birth order, or even us, no? So when you are an eldest child, it seems that you are alone for the first few months or years until the second child or second baby is being born. So when you are the eldest, usually you are the center of the family. So when you have the baby, the second child, for you, it seems that you feel neglected. You even want to harm your younger sister or brother. So what happened in there is the second child have a competition to the eldest child. No? So most of the time, the eldest child and the second has usually a conflict. That is because of what you call the children's birth order. The eldest child feels displaced because here comes the second baby or her younger or her young the baby brother, which before he was the center. So he becomes or he became or she became displaced. And the second child became or becomes competitive with the eldest. The youngest child is do not feel displaced because being the youngest, it seems that everybody's attention is towards the youngest child. So it is given already. Sometimes we have some, what you call, there are favoritism, no? Because that is according to Alfred Adler that it has our behavior. Children's birth order has something to do with our behavior. So meaning to say, you also try to examine yourself or be aware if you are the eldest, if you are at the middle, if you are at the youngest. Because mostly, if, for example, you are 5, the eldest is given already and the youngest that the center of attention is to the eldest and to the youngest. Although the eldest feel that when there is the second baby or younger baby, he feels displaced. So that's why the eldest try to become responsible, or sometimes they are the worst, no? Because of that feel of displacement. But actually, that is given already implied that when you are the eldest or the youngest, you are the favorite, no? The middle child, although, for example, second or the third, they usually compete with the elder sister or brother. So what do? The middle child or the second child, no? You can observe that the middle child is usually, they are either the best, they excel in school, or they are also sometimes the worst, no? To compete with the elder sister or elder brother. That is the importance of children's birth order. So what is the treatment, or what is the, how can you alleviate this? No, the inferiority complex, the children's birth order. So Alfred Adler said that we have the primary therapeutic approach, and that is encouragement and human relatedness. Meaning to say, if the child, if they have inferiority, it is if you are aware of this, the psychiatrist, no, the clinician should give just an encouragement or show that it is good to have a peer group or good relationship or interrelationship with your friends and with other people, no? To cover up your inferiority, your childbirth, and other thing that would make you feel disturbed or bad, no? You feel not good. So encouragement and human relatedness. It is given by a psychiatrist when you are being treated, no? Then you have John Bowlby, no? See, you still have 1907 to 1990, no? It's another psychiatrist, and he is the founder, he was the founder of attachment theory. He formed his ideas on attachment in the 1950s, consulting with W on the problems of homelessness on children. So what is attachment theory? How can you differ with bonding theory, no? Or bonding. So sometimes you said that, ay, nagbanding-banding kita, we'll have to have a bonding. Bonding tayo. So how would you differ between attachment and bonding, no? So you can observe that in attachment, no? There is the so-called attachment when you feel that the other person can be relied by you in case of security, in case of affection, in case of love. So that is attachment. Meaning to say, you can get security from that person. You can get love from that person. You can get affection from that person. Whereas in bonding, bonding is, for example, when the baby is born, the baby is being brought to the side of the mother. So there is skin-to-skin contact. There is to eye contact. Even the baby, if she can hear the voice of the mother, that is bonding. There is the mother could not get a security from the baby, no? Unlike in attachment theory, the child or we can get security or love or affection from the person. No? That is attachment. Bonding is just a skin-to-skin contact or voice contact or eye contact. So that is bonding as compared to attachment. Because sometimes there is a misconception, no, of what we term, what we use, the word attachment, between attachment and bonding. So now you will understand, and I even have already given you the lecture on attachment and bonding. What the difference between attachment and bonding, no? So you can see that the essence of attachment is proximity. So meaning to say, you tend to be close to your mother because you feel you can get love, you can get affection, you can get what you call sense of security. That is attachment. So those are the contributions into psychiatric thoughts. You have Anne Freud. Anne Freud is the daughter of Freud, the father of psychiatry. No? Still new also, it is 1895 to 1982. So you can observe it's really very, recent, no? New science. No? So Anne Freud is the daughter of Sigmund Freud, father of psychiatry. However, Anne Freud elaborated the individual defense mechanism. So meaning to say, we have some defenses in us in order for us not to become neurotic or psychotic, no? Not to become hurt, no? So you have reaction formation. Later, I will, when you are in the second year, you will know what is reaction formation, but maybe you can go ahead for reading, no? You have regression, no? Undoing, introjection, identification, projection, turning against the self, no? When we say turning against the self, this is usually, you become depressed, no? Turning against the self. That is a kind of defense mechanism. No? So reaction formation is, for example, you have your stepmother. Your stepmother does not want you, but however, to cover up, she tried to give you something. No, she tried to keep giving you some dresses. That is reaction formation. Regression is trying to, when you go to sleep, you regress. At the end of the day, you tend to regress, you are tired, so that is regression. Undoing. Undoing is when you try to, you have some fantasy, you have some dreams, no? And you try to do it in the opposite way. You become irritated. Introjection. Introjection means you try to internalize the characteristic of somebody you love. For example, your mother, your father, especially when you have conflict and they got sick. So you try to introject their characteristic that as if when they are not around already, when they died, you feel what they feel. For example, they have heart problem. So as if you feel also that you have a heart problem. That is introjection. Identification, from the word identification. Identify. You tend to identify whom you have the hero worship. You try to identify the people you want to. No? Projection is you cannot accept that characteristic, that thoughts in yourself. So you try to throw away to others. You try to draw away from you because you cannot accept that. That is projection. You project yourself to others because it is unacceptable to you. Reversal from the word reversal. No? Sublimation. What is sublimation? As I've said, anyway, we will go into this, into a deeper one, but I will give you just the background. Sublimation is sometimes when you are messy and you turn your messiness into, you become painter. No? That is sublimation. So, Freud also give the characteristic of modern ego psychology and child psychoanalysis. So, you know the different characteristic or the different function of ego. What is ego? Ego is reality. That is ego. And he also go deeper in here on the treatment of children, of the child, and that is child psychoanalysis. Psychoanalysis is you let the thought of your child surface because of the many conflicts that is hidden or being buried in her or in his mind. There is also what you call adult psychoanalysis. No? Bring up to the surface the different conflicts in life, in your thoughts. No? Adult psychoanalysis was done by the father of Anne Freud. But here Anne Freud did psychoanalysis on the child and the modern ego psychology. No? So you have id, ego, superego. Id is your drive or instinct. Ego is your reality. Superego is your consciousness, moral. No? So that is according to Freud and Freud, he postulated the modern ego psychology and child psychoanalysis. That is treatment. When child has behavioral changes or behavioral pathology, according to Freud, the child can have the treatment of psychoanalysis. Then you have Kurt Goldstein, 1878 to 1965. So he's also from Germany. That is Gestalt psychology. Gestalt psychology is one part of you is related to the other part. So when one part is being destroyed, the other part of you also is affected. That is Gestalt psychology. So it is said what happens in one part of the organism affects every other part. And what is what you call holostenosis. He also postulated the self-actualization, described the person's creative powers to fulfill their potentialities. Meaning to say, each of us has potentials. So, with all those things, with all this inferiority complex, without other things that could disturb us, that could affect our behavior, Kurt Goldstein has the postulation on power to create your potentials. So you have what you call self-actualization. So these are the contributions of different doctors, psychiatrists, and psychologists. So you have Gustaf Chung. No? They are a very important person who contributed to the behavior of men. And that is from 1875 to 1961. So he's a Swiss psychiatrist. No? Maybe some of you later can would become the author of some, it's called that behavior, newfound behavior postulations of man, no? Because psychiatry is still new. So you can see here that Gustaf Chung has postulation on the anima and animus and animus. So this anima and animus usually comes in when we are already on the midlife. For example, you are already 50 or 50 usually. What is in here? So you can observe that at this stage, there is the man's undeveloped femininity and there is a woman's development of masculinity. So you can observe that at this stage, there seems to be a reversal of role in the characteristic of man and woman. So at this time, sometimes in the family, you can observe that the man start to become concerned. The family, like for example, they start to clean the house. They start to have so many concerned and petty characteristic at home because that is the man's undeveloped femininity. And on the other side, the woman's masculinity. So in there, you can observe that there is already a harmonious, it results sometimes to a harmonious relationship because there is a reversal of the characteristic of man and a woman. Not homosexual, no, not homosexuality. It's just an undeveloped femininity of a man, and that is an undeveloped woman's masculinity. So there is reversal of role in the family. So when you have that, as I've said, sometimes it results to a good relationship because there is a shift of characteristic of a man to have the femininity characteristic and the woman to have a masculinity characteristic. So that is Carl Gustav Jung. Then you have Adolf Meyer, that is 1866 to 1950. So it's very young, no? He is also a Swiss psychiatrist. So he emphasized the interrelationship of symptoms and individual psychological and biological functions. So meaning to say, there is a connection between the psychology and biological characteristic with regards to the symptoms of an individual. Meaning to say, there is the factor of psychological and biological characteristic comes in with the symptoms of some behavior of man. So that's why you have psychology, the study of behavior of man. You have biology, what are the characteristics of a female, a male, because the pathology or the disease symptom is related to the psychological and biological function of man. So what is an example biologically? So biologically, it is said that women are more prone to have some depression because one woman has give birth, no? We have so many biological characteristics which cannot be found in man, no? So there are more profound psychiatric problem in female that cannot be found in male because of our biological makeup. We are prone to depression because of our biological makeup. No? We give birth, we usually stay at home even before, long time ago when the women are not still working. So we have the tendency to be, let us say in quotation, an introvert, because it is a function of the woman to stay at home, to give birth, no? To have menstruation, and these are already related to our different hormones, no? Which men is a different. They have only testosterone. Woman or females have progesterone. We have your estrogen. So when we are having some still menstruating, we have estrogen. When we become pregnant, we have some progesterone. When we flirt, we have some estrogen. No? So females, be aware. So when you try to flirt, you feel, what you call that, frustrated with your crushes, no? So you are affected so much because of your estrogen. When you become pregnant, you already have your progesterone. So it affects so much to our symptoms of behavior and thoughts as being a woman or a female. So on the other side, the male has no that testosterone. They only have testosterone, but don't have the estrogen and progesterone. So we have a different biological functioning, and even psychologically, men are usually more on thoughts first before they go on their emotion. Females are more on emotion rather than thoughts or thinking. We usually use emotions, unlike males that they use more of intelligence or their cognitive function before emotions. So that is by Adolf Meyer. Beef Skinner, you can see that is operant learning. So he said that behavior can be learned, can be changed, can be maintained, can be affected, especially if you have your rules of reward and punishment. You know this one. I will not go deeper in operant learning. You know that. The what you call that? That is the rat. When the rat tries to push a button, and the button, there was some pellets coming out, so he was able to eat. That is operant learning. Aristarch Sullivan. So Aristarch Sullivan, that is in 1892 to 1949. So he tried to, through psychotherapeutic treatment, he tried to treat psychiatric problem, not so much on medicine, but on psychotherapy. So you just talk with the patient. There are techniques in this. There are bases. There are what you call characteristics on how to go with psychotherapeutic treatment. No? So that is the different school of thought of different people in psychiatry. So, any question? So I hope you're able to get in. So our exam is, I will just submit the questionnaires maybe. Can I have it on Monday? Where is ma'am, your coordinator?
Yes po, Doc.
Maybe I can just submit that on Monday. Can I submit on Monday?
Niyakan po ni ma'am siya, basta 3 days before Monday daw.
How many days?
3 days before 3 days before November 21.
But di ba we tried to shifted our schedule on November 28?
Yes po, Doc.
November 28. But anyway, I will submit my questionnaires to your, whom will I give? Just here? Or to ma'am? Is your coordinator?
Ate man, Doc, email kan ma'am siya. I'll just give you the
Ma'am
email.
Sha, Ma'am Sha.
Opo.
So I will
Adi
just
po
give
ako
it to
ng
Ma'am
email.
Sha. I will just give it to Ma'am Sha maybe Monday. Okay?
Sige po, Doc. I'll send you the email na lang po.
Okay, but we will have our examination on November 28th. That's Saturday.
Opo.
Okay. So what time shall we have our exam? 9.
Morning
So
na lang.
how many hours? 2 hours?
Yes po, Doc.
So your exam will cover your first quiz and your first bi-monthly. So maybe 2 hours. So anyway, we'll just submit to your Ma'am Sha. So you have various types of questions. You have essay, you have matching, you have what you call that? Other types of exams, no? Other characteristic, no? Of your examination. Just read, no? Anyway, it's just easy, no? Anyway, you will not be disturbed anymore because it's after your major examinations, no? So you can study, you have adequate time to study, no? Because we will take that on November 28th. So maybe 9 to 11, 9, 10, 11, 9 to 12, 9, 10, 11, 12. 9 to 10 to 11 hours. 10 to 12. 10 to 11, 11 to 12. 10 to 12, would it be okay for you?
Yes po.
You don't have an examination during that day. You don't have exam anymore, di ba?
Opo, Doc.
Oh, so can we have that 10 to 12? By canvas. Just tell Ma'am Sha that I will give my examination on Monday to her.
Okay po, Doc.
Okay? So I would like to say good luck to your exams, no? For your first quiz and your bi-monthly. Okay? Just prepare for 100 questions. Okay?
Okay po, Doc. Thank you.
Thank you, Doc.
Okay? Just prepare
Thank you
for
po.
100 questions.
Doc.
Okay, sige.
Thank you, Doc.
Good luck to your other examinations. Okay, and stay safe. Okay, bye-bye.
Thank you, Doc.
Thank you, Doc.
Bye, Doc.
Thank you po, Doc.
Okay, take care. Maaraw dito niya rin ko na. Send ako to. Oo, send na lang.
PowerPoint yan, Doc.